time.
Thanks, Senator Bennett. Senator Collins.
Thank you, Mr. Chairman. Dr. Price, welcome.
Thank you.
I, too, very much enjoyed our discussion on a wide range of healthcare issues in my office. Many of us have expressed concern about what would happen to the millions of Americans who are in the individual market of the ACA on the exchanges. But there has been remarkably little debate on what would happen if Congress took no action with regard to the individual market. Could you give us your answer as far as what you would see happening to the individual market if we do nothing?
Well, I appreciate that, and I appreciate the opportunity to come visit you. We had a wonderful conversation about many, many different areas. The American people know this. They appreciate that the individual and small group market, where many of the millions, as the chairman pointed out, gain their coverage, is breaking in many, many ways. We're in a downward spiral on being able to provide individuals any opportunity at all. So 1/3 of the counties in this nation have just one insurance provider. There are 5 states that have only one insurance provider. There are the premiums are going up for folks, the deductibles. I get calls almost weekly from my former fellow physicians who tell me that their patients are making decisions about not getting the kind of care that they need because they can't afford the deductible. If you're an individual out there making $30,000, $40,000, $50,000 a year, and your deductible is now $6,000 or $12,000 for a family, which is not unusual on the exchange, you may have an insurance card. It may have a wonderful name of an insurance company on there, but you don't have any care because you can't afford the deductible. And so people are denying themselves the kind of care that they need, and those are the things that we ought to be addressing. And again, I hope that in a bipartisan way we'll be able to do that.
Thank you. I think that's a very important point to clarify, that in the individual market, we're seeing double-digit increases in premiums, higher deductibles, larger co-pays, and we're also seeing far fewer choices as more and more insurers give up and flee the market. The co-ops have failed dramatically. All 23 of them are in financial trouble. Only 5 are still operating. So for us to say that everything is going well with Obamacare is just not accurate. And that's why I feel that we do need to fix the flaws of what is a well-intentioned but deeply problematic law. I want to clarify another issue on the ACA. There's been much debate on whether we should repeal the law with no replacement. I think most people reject that idea. As you said, we don't want to pull the rug out from under people who are relying on the insurance that has been provided through the ACA. Another group has advocated repeal with a 2 or 3 year delay. I think that approach also doesn't work because it creates great anxiety for consumers, and insurers would be unable to price their policies if they don't know what the rules are going to be. It's my understanding that your goal is to quickly pass a reform package that would provide access to affordable health insurance for all Americans with more choices that we have now. Is that accurate?
Absolutely. It is vital. We oftentimes don't talk also about the 20 million folks that still don't have coverage out there. There are a lot of people that don't, and if we're responsible policymakers and administrators of policy, it's incumbent upon us to step back and say, why is that? What's going on that's making that happen for those 20 million who don't have coverage in spite of all of these grand things that were done? I would suggest that it's because the structure of what was done actually makes it virtually impossible for many individuals to gain that kind of coverage. We, on the other hand, I believe it's important that we work together to put forward a system that actually allows, again, every single American to have the opportunity to purchase the kind of coverage that they think is best for themselves and for their families.
So your goal is actually to have more people,
Yes.
thank you, covered by insurance. I have been baffled over the years by what CMS reimburses for and what it fails to reimburse for. Senator Jean Shaheen and I finally scored a victory of getting CMS to cover continuous glucose monitors for individuals with diabetes that have been covered by the vast majority of private insurers. But when those individuals aged into Medicare, they lost that coverage. Made no sense whatsoever. What I'm finding now is that CMS frequently does not pay for services that helps to keep people well. There is a large practice in my state that has a nurse or a medical assistant call individuals with diabetes once a week and check on their blood sugar levels, their adherence to their diets and exercise regimes. And it's had really positive results. Well, the irony is that if diabetes gets out of control and those individuals end up having to have amputations or go blind, CMS, Medicare will pay for that, but it won't pay for that phone call to check on the individual that's helping to control their diabetes and keep them well. Will you pledge to take a look at those kinds of policies and reevaluate what we do pay for?
Absolutely. It's imperative that we're constantly looking and determining whether or not we're getting the outcomes that we want, and the processes are either helping or obstructing those outcomes.
And finally, I want to touch on biomedical research, which is a passion of mine. I founded both the Diabetes Caucus in 1997, and I also am the founder of the Alzheimer's Task Force in the Senate, which Senator Warner is the co-chair of. Alzheimer's has become our nation's most expensive disease. It costs society $263 billion a year. $150 billion of that comes from Medicare and Medicaid. It's going to bankrupt those programs. It's devastating to families and the victims of the disease. Diabetes consumes 1 out of 3 Medicare dollars. If we invest in biomedical research, we have the possibility of not only improving lives for Americans and curing or coming up with effective treatments for devastating diseases, but also actually lowering healthcare costs. Do you support the increases for NIH that we have passed in the last year and are on track to pass this year as well?
Yeah, NIH is a treasure for our country, and the kinds of things that we should be doing to find cures for those diseases. One of the core avenues to be able to make that happen is through NIH, and I supported the increase.
Thank you. That goes along with your principle of innovation.
Absolutely.
Thank you.
Thank you.
Mr. Chairman.